Hello, I'm Dali, a hypnotherapist, pharmacist, and research specialist. I will present our new review, Demystifying Hypnosis.
Despite supporting evidence, myths and misconceptions perpetuated by the media and stage hypnosis prevailed, eliciting fears impeding the adoption of hypnosis in research and clinical settings, as shown by high rates of attrition in studies, negative attitudes in surveys, and low rates of use. In contrast, based on surveys, willingness and motivation to be hypnotized were linked to positive attitudes and receiving adequate information.
Contrary to misinformation and misconceptions, accurate information dispelling myths can enhance attitudes towards hypnosis and promote its adoption and acceptability. This narrative review aims to advance knowledge on hypnosis amongst clinicians and the general public and thus promote its adoption and acceptance. This review traces the history of myths surrounding hypnosis and its evolution as a treatment modality, compares hypnotic and non-hypnotic interventions with similar procedures and features, and presents evidence to demystify hypnosis and alleviate related myths. The results were recently published. Here is the QR code for the full text. Although hypnosis has been used since early history, its medical practice emerged in the 18th and the 19th centuries. In the 18th century, hypnosis vocabulary was established and hypnosis was used in medical context mainly for acute pain. In the 19th century, hypnotic analgesia was widely used during surgeries and on the World War's battlefields, despite the popularity of anesthetics. The modern era of hypnosis started in the 20th century with its increased use for pain, the development of hypnotic suggestibility scales, and the research of Dr. Milton Erickson. Medical hypnosis was endorsed in medical context by the British and American medical associations and in psychotherapy by the APA. However, hypnosis literature remained anecdotal and based on case reports. In the 21st century, hypnosis research surged and showed its effectiveness for varied biological and psychological conditions. Agreement also emerged on common hypnotic practices and clinical effects. Contrary to myths associating it with somnambulism, influenceability, gullibility, robot-like responding, and amnesia, hypnosis is distinct from sleep and mainly influenced by individual variables such as hypnotic suggestibility. Hypnotized individuals can resist suggestions and remember what occurs during hypnosis or breach hypnotically induced amnesia. Although relaxation techniques are beneficial with hypnosis, hypnotic effects are not merely due to relaxation. Despite overlapping features and procedures, hypnosis differs from distraction, imagery, meditation, mindfulness, psychedelics, and breathwork in procedures and mechanisms and can be combined with these interventions to enhance therapy. By dispelling myths, highlighting research gap, and discerning between hypnotic and non-hypnotic interventions, the review can advance the science and practice of hypnosis. Further studies should explore the implementation, feasibility, and acceptability of hypnosis to promote its dissemination and adoption. Although the review suggests potential value in coupling hypnotic and non-hypnotic interventions, the utility, acceptability, feasibility, and implementation of these combinations require examination. Thank you.